Good day, everyone. My name is Qatar Al Jr., a first-year nursing student from Davao Doctors College, and today I will be performing a return demonstration on taking a vital signs. We all know that a vital signs are an object measurement of essential psychological function of a living organisms. Traditionally, the vital signs consist of temperature, pulse rate, a blood pressure, and respiratory rate. But before we start, let me show you what are the equipments that we'll be needing for today's assessment. Now, we will be needing the digital thermometer for checking the patients, and then together with the cotton balls and alcohol for disinfecting. And the equipment before and after using it, sphygmomanometer and stethoscope, which is used to measure the blood pressure of the patient. And then I have my patient's worksheet here and pen, which I'll be using for writing and documenting the data being gathered. And also don't forget the wristwatch with second hand, which is used for measurement of the values of the pulse and the respiratory rate. Since I don't have a pulse oximeter with me now, I will be excluding the checking of the oxygen saturations, and it is important for the completeness and organization of our equipment because it ensures our efficiency as nurses. So now, the first vital sign that we will be taking is a temperature. So the normal temperature is 36 to 37.5 degrees Celsius or 96.8 to 99.5 degrees Fahrenheit. So there is 5 thermometer placement which includes temporal, rectal, oral, tympanic, and axillary. In preparation for checking the temperature of the patient, make sure that you already perform a proper hand hygiene. And then, use gloves if necessary, but also check if the patient has no allergies and latex materials. And then, I will be preparing all the needed equipment that I use, which mainly consists of a thermometer, and then check if the needed equipment is functioning normally. So I'm gonna check this, if it is functional. If it functional. And it is functional. So prior to performing the procedure, first I need to introduce myself. And ma'am, I am a Qatar College Jr. I will be your nursing student for today, and for the hours that I will be taking you is to 11 p.m. to 5 p.m. So can you state what your name, please? I don't mind this because I'll be checking if it is functionally working. So what's your name again, ma'am?
Joanna Duran.
And your date birth?
August 17, 2002.
Okay, I will be checking your temperature today, ma'am. And I want you to be comfortable, position yourself. I will be taking your temperature so that I can give you the right plan of care. But first, I need to adjust the temperature, remove the aircon, and giving you your privacy, okay? So, since I will be taking my patient's temperature in your axillary, I will ask her to position herself her comfortable pace. And then I'm gonna wipe the tip of thermometer with an alcohol swab in a firm twisting motion prior to placement. And then pat the axillary dry if very moist, if you moist your axillary map. So then the tip should be placed in the center of the axilla. And then I will be waiting the appropriate amount of time until the thermometer beep. Okay. So I'm gonna taking this up now, if it is okay to you. Check that. That's it. It takes time to wait the result of the pressure. Temperature rather. So, are you comfortable with that, ma'am?
Mm-hmm.
Okay. So let us make sure if the patients are comfortable with us. checking one with this word and okay. It really takes a long time to get the temperature of our body. Oh, there you are. So I need to remove the thermometer and the auxiliary of the patient, and I need to swab it in alcohol. But first, I'm gonna tell you the result of your temperature. It is at 37.0 ma'am, which is it is in a normal range. So after measuring her temperature, I need to record it and my patient's worksheet. You have 37.0 Celsius. I'm gonna put aside in here. So I need to wash the thermometer if necessary and return it to the storage location. So I need to return here because I already done washing this. And then I already done documenting the temperature in the client, because in order to allow other clinicians to understand the patient's history, of course, so that they can continue to provide her best possible treatment for each individual. So now, the next vital sign that we will be taking is the pulse. We all know that a pulse is a wave of blood created by the contraction of the left ventricle of the heart. We need to measure the pulse in order for us to identify whether it is within the normal range, also to monitor the clients at risk of pulse alterations, like patients with a history of heart disease, acute pain, fever, or many other moods. So there are 9 pulse sites that you can use to obtain the pulse rate map. This includes the temporal, carotid, brachial, radial, apical, femoral, popliteal, posterior tibial, and the dorsalis pedis artery. So the normal pulse rate for an adult is 60 to 100 BPM. So in a preparation, for checking the pulse rate of the patients, prepare all the needed equipment. Since I will be checking the pulse rate in the radial artery, I will be just needing a wristwatch with a Swiss second hand before doing the procedure. So remember to do a hand hygiene first. Then, prior to the procedure, I'm gonna introduce myself again. So ma'am, I am Dr. Bacoli Jr. I am your student nurse for today. And then, I need to confirm your identity for using the agency protocol, and I will be explaining that we will be checking your pulse rate and tell you to participate in the procedure. Okay. And then after that, we will now proceed with choosing our pulse point. I will be measuring the pulse rate in the radial artery, since this is the most accessible pulse rate site. Are you feeling nervous, ma'am?
No.
Okay, that's good. So, since I assist my client in a comfortable position, the forearm rests across the thigh with the palm of the hand facing downward and inward in taking the pulse rate. Avoid using the thumb because the thumb has its pulse and it can be mistaken as the patient pulse, which will cause an inaccurate number of BPM. Use 2 to 3 fingers, preferable index, middle, and or ring finger. Count for 15 seconds and multiply it by 4. And since I already done it, as you can see, so I need to record the pulse in a beats per minute on your worksheets. And then I will be Assessing the pulse rhythm and volume. Pulse rhythm may be classified as regular or irregular. On the other hand, pulse volume may be classified into 4-point scales, 0 being absent, 1 being weak, 2 being easy to palpate, and 3 being full, and 4 being the strongest. Since I document the pulse rate, rhythm, and volume in the client record. And I will be doing a proper hygiene. Forget about it. So ma'am, your pulse rate is 75 beats per minute. That is graded 2 plus, which means it is normal and it has a regular rhythm. And your respiration rate is 16 breaths per minute, which is within a normal range. And so next, we move on to the vital signs that I will be assessing is the respiration. So the respiration rate is the number of breaths a person takes per minute. The rate is usually measured when a person is at rest and simply involves counting the number of breaths from 1 minute by counting how many times the chest rises. So 1 rise and 1 fall is equal to 1 respiration. Normal respiration rates for an adult person at rest range from 12 to 16 breaths per minute. The easiest way to observe the respiration is to look at the client from the side and notice and how her chest ground rises. So in a preparation for the procedure, check the equipment needed. So I will be using a wristwatch with a sweep second hand. So before I conduct an ed, I need to be comfortable and remember to do a proper hand hygiene. Again. So, proper the procedure, I need to introduce myself again. So ma'am, I am Kato Emakol Jr. I will be your student nurse for today's day. And now, I will be confirming your identity again, ma'am, for the agency protocol, explain what we'll be checking your pulse rate, and tell you how you can participate in the procedure. So provide client privacy. And then I will be observing my client breathing if she has a normal breathing rhythm, or she might have regular breathing if she breathing rapidly or too slow. Also, sweating is one of the indication that the client is having a regular breathing. Since my patient has a regular breathing, I will count the respiratory rate for 30 seconds and multiply it by 2. But if your patient has an irregular breathing rhythm, count the respiratory rate for a full 60 seconds. Then I will be observing the depth, rhythm, and character of respiration, if it is irregular or regular, or if the patient is breathing effortlessly, or if the patient is having a hard time breathing. Then I will be documenting the respiratory rate, rhythm, and correcting of respiration in the client record sheet. Okay. So, ma'am, be comfortable, okay? It really takes a long time. Oh, I heard that. Okay. So, ma'am, your respiration rate, you have a respiration rate of 12 to 20 BPM, and that's good to hear, okay? And it is a regular rhythm. So, I will be keeping my patients informed in a good way to gain her trust for me and have a better relationship with me. By this, they will be able to understand her health status, and she will be able to raise questions and share opinions regarding her health. So, after that, I need to move on to my next vital sign that I will be measuring is the blood pressure. So, blood pressure is the force of the blood pushing against the artery walls. During contraction and relaxation of the heart, each time the heart beats, it pumps blood into the arteries, resulting in the highest blood pressure as the heart contracts. When the heart relaxes, the blood pressure falls. So there are 2 numbers when measuring blood pressure, which are referred to as systolic, first number, and diastolic, second number. The blood pressure is categorized as normal elevated, or stage 1 or stage 2 high blood pressure, and then the normal BP is 120/80. So in preparation for the procedure, I need to check my equipment again. We will be an aneroid sphygmomanometer, a blood pressure cuff, and a stethoscope here. Ensure that the equipments needed are functioning normally. So before conducting the procedure, okay ma'am, I need to introduce myself again. I am Dr. Bacol Jr., a student nurse from NAP. So I will be performing the proper hygiene again. Okay. Going to proper again so that it's a better bet. It's a very proper way. So by doing this, I will tell the maximal pressure, which is sphygmometer, needs to be elevated in the subsequent determination. I need to wrap the cuff around the upper arm and locate the brachial artery, palpate the brachial artery with my fingertips, close the valve in the bulb, pump the cuff until you no longer feel the brachial pulse. In the actual procedure, we will be needing a stethoscope. Before using the stethoscope, disinfect the earpieces and all the belt of the stethoscope. Okay, I have a cotton balls here, which is, this is the proper way, okay? Okay, ma'am, I will be on your, so you're comfortable, okay? So, ma'am, oh, you do it for me. Thank you so much. Tell me if it is too tight or something like feels or loosened. So I need to. Okay. I need to you to. I already located your lips. So, oh. Okay. So, I need to repeat the procedure, but this time I will be using the belt part of my stethoscope to palpate the brachial artery to help me have a better hearing of the low-pitched sound, and I will pumping the cuff of the until estimated BP plus 30 mmg. So I will need to release the cuff carefully so that the pressure decreases at the rate of 2 to 3 mmg per second. So, the first beat that I heard was her systolic number, while the last beat that I heard would be the dystolic number. So since my client initial examination, I will be doing it again on her other arm. Okay, I'm gonna do it into your other arm, mommy, or is it okay to you? You're always doing this by for me. I will be the one who of that, but thank you so much for your cooperation. Is it okay for your mom?
Mm-hmm.
Okay. So I will be checking this again. And fine. Wait lang ha. Just wait. Okay, I heard some. Please up now because it is elevated in the heart. Oh, I heard that. Okay. Thank you, ma'am. Okay, need to remove this. Seems like you're in a relax. So, ma'am, since I got your blood pressure is 120/80. Good to hear that, which is considered a normal range. So thank you so much for your cooperation, ma'am. After doing all this assessment, remember to write it on your report and document all the data on the client's record sheet or the TPR sheet to allow the other clinicians to see the patient's history. And also don't forget that after the procedure, remember to do a proper hand hygiene to avoid the transfer of microorganisms. But first what I do, and ma'am, I need you to have proper hygiene because you're contaminating. And that would be all. Thank you. This is for my return demonstration in obtaining my patient vital signs. Thank you very much.